Hi everyone, thank you for tuning in for today's YouTube live video. I'm Alexandra with MDPen. Today I wanted to talk about stretch marks and how we are facing a deadline if you are trying to treat your stretch marks by summer or to have results for summer. Now, when we think of stretch marks, they really do fall into a scar-like category when it comes to microneedling because they actually are technically a scar. And when stretch marks are microneedled, they are treated at a higher depth typically so that the scar can be reached. With situations of stretch marks, you always need about a minimum of 4 treatments, sometimes upwards to 8 treatments, depending on the severity of the stretch marks. When they first appear, you may have stretch marks that are pink, red, purple, really just depends. These are new stretch marks. As they start to develop, and once you've had them for a while, they tend to be more white in color. So this is how you can really determine whether a stretch mark is new or old. And when you're treating with microneedling, it's going to be similar to a facial microneedling treatment in the fact that you want to do the treatments at about a month apart. When you come in, the protocol is still going to be the same. You will be numbed for the treatment, and your professional will talk to you about how they're treating them. Now, with stretch marks, one thing you want to keep in mind is there can be a longer downtime. So your skin will not always look totally normal within 2 days of having your stretch marks treated, especially if you are a skin type 4, 5, or 6. So typically this falls into skin of color. And you can have that post-inflammatory hyperpigmentation for quite a while. I've seen it happen for up to a few weeks. So that's something you do want to keep in mind. With stretch marks, it's very similar to laser hair removal in the sense that you do not want to come in with a tan, whether that be a tan from laying out, a sunburn, or tanning beds, or self-tanner. So you don't want to come in with any type of tan. Make sure your skin looks like your actual skin. This can really affect the treatment and set things off. So you're better off rescheduling if this is the case. Now, since we're already in April, you would want to do a treatment now, a treatment in May, and a treatment in June. If you don't see yourself being able to stay away from the beach, the pool, being outside during July, August, maybe even September, you may want to go ahead and just take those months off. As much as it's not great to keep going with your series, you're better off taking that time off than you are coming in and then being non-compliant and going in the sun. And for those of you that are professionals, you do want to explain this to your clients and patients. They should not be in the sun after having stretch marks microneedled. And in many cases, they may have that post-inflammatory hyperpigmentation. So you want to let them know that so that they're not upset. Like, oh, I'm supposed to be in a bathing suit next week and I have, these grid marks from you treating my stretch marks. So you do want to let them know that. Of course, there's things that can help speed along the healing, like our human-derived growth factor gel and other types of moisturizers made by MDPen. Now, as far as dermatologists go, and anyone who's watching can correct me if I'm wrong, but one of the only prescription type treatments that they have found to help stretch marks is going to be vitamin A topically, like a retinol, retin-A, tretinoin. And with MDPen, we do have a 1% retinol. So that is something you could definitely pre-treat with and use between treatments. Of course, it's something you'd want to stop the week prior to your treatment and stop for 1 week after treatment. But it is something you could do at home to kind of help turn that skin over, move things along. I would definitely do the 1%. We do also make a 0.5, but for stretch marks, I would go straight to that higher percentage. And that's something you can definitely do when it comes to that. You can moisturize your stretch marks. Sometimes if you have new stretch marks, that are coming, you can definitely moisturize them. They can first appear as being very itchy because your skin is basically stretching. So by moisturizing, you can definitely alleviate some of that. You can treat stretch marks that are more on the new side. You don't have to wait until they're completely white. In this sense, it is different than a surgical scar where you would want to wait a minimum of 6 months before microneedling. So with stretch marks, you can get in there and treat them a little bit faster. If you guys have any questions, comments about this topic, please feel free to write them in the Q&A box. I am so happy to answer them for you guys. For those of you that are interested in our 1% retinol, we just put out our Mother's Day special, and it's our Sleeping Beauty kit. It does include either the 0.5 retinol or the 1% retinol. And then it's also going to have our wonderful Revita Peptide Moisturizer in it. This is our cream-based moisturizer. This one is biopeptide complex, amino acids, squalane, hyaluronic acid, shea butter, hibiscus, rosemary oil. I absolutely love this product. These two go together really well. As you can see, they're in similar pumps. Depending on the surface area that you're treating, you can do a pump of each and mix them directly together, or you can put the retinol on first, followed by the Revita peptide. The cool thing with our retinol is it is a blend of pre and probiotics in it, and it also has niacinamide. So this is really great for balancing the skin. If you are oily in some areas, combination, perhaps dry in others. We included ceramides in our retinol. So if you're using this for body, for stretch marks, this could be enough, moisturizer for you with the ceramides in it. And then, you could use Revita for your face and neck. This does have a growth factor in it, particular to the neck. So professionals, if you have someone asking you for a neck cream, you can definitely use this one. I do see some questions here. Can retinol fade stretch marks? So the retinol can help, as I said, move along the stretch marks by helping to exfoliate them. So the short answer would be yes. There's a link right there, guys, for the kit. If you are a professional, you are probably you've probably been sent an email this morning with the professional pricing for these Sleeping Beauty Mother's Day kits. The third thing that's also in the kit is going to be a lavender sleep mask branded with MDPen, and it has a very mild lavender scent to it. Very comfortable. I've worn it. It's very nice, and it does block out any light so you can sleep better. Can you microneedle red stretch marks? Yes, you can. I wouldn't do them like just as they're coming in and they're itchy, but once you've noticed them and they've been there, a month or two, yes, you can microneedle them if they're still red or pink, as long as you're not confusing it with a hypertrophic scar, which would be really difficult to do. Those are very red, angry scars. So with stretch marks, yes. How deep should you microneedle for stretch marks? Great question. So with stretch marks, you want to be at about a minimum of 1.5. And in cases of skin of color, Fitzpatrick 4, 5, 6, if it's your first time treating a stretch mark patient, I would not recommend going over the 1.5 just to see how their skin reacts, see how long their downtime ends up being. But in other situations, you can get up to the 3 millimeter mark with your MDPen when treating stretch marks. Of course, with different RF devices, such as the Intensive from MDPen. With the Pro device, you are at a 5 millimeter when you treat stretch marks. So you can really get in there. If you guys are interested in RF microneedling, MDPen does have information on that as well. I think I answered this. How many sessions will it take to see results? Typically, it's 4 to 8 treatments, depending on the severity of the stretch marks. The other nice thing with treating scars and stretch marks is, although you do continue to lose collagen because you are aging, you are losing elastin, the results of stretch mark and scar treatments can often last a little bit longer than maintaining results for anti-aging, pore size, sometimes acne scars on the face. But with stretch marks, you're not going to need the touch-up treatments quite as often. So the results are going to kind of stick around longer. Do you recommend microneedling with PRP for stretch marks? If you have PRP in your office and you're able to use it, absolutely. It's going to help along the healing time. So applying PRP topically, using our human-derived growth factor gel after the PRP. I know some injectors do inject PRP directly into the stretch marks, and I have heard some great results coming from this. So absolutely, if that's something you have, you can definitely utilize it. Let me see if I missed anything. Which one is more effective? Okay, I answered that. So yeah, the RF microneedling, you are going to be at a higher depth. And with MDPen, you do have the non-insulative intensive needles. So you're treating all of those layers of skin all the way down as you're reaching the stretch mark. So nothing goes missed. I would say one treatment with the intensive RF from MDPen would be equal to 2 to 3 microneedling treatments with MDPen, depending how your skin responds. But I will say our MDPen is very efficient at treating stretch marks. I've seen amazing results. The motor on our microneedling device does go up to 17,500. So when you needle a stretch mark, you can definitely be at that high speed and you're getting all of those injuries. So stronger than any other pen. I'm not seeing any more questions here. Thank you guys so much for all of this engagement. With the Mother's Day Sleeping Beauty kits, they are already discounted. And as I said, you can buy them as retail on our website if you are looking to purchase one and you are not, an esthetician, PA, doctor, nurse practitioner, you can still buy them from us. You don't have to be a professional with MDPen. We do have them available on the website. The 1% is going to be a few dollars more than the kits with the 0.5% retinol. So that if you see the difference in price, that's what that is. And if you are a professional, you can also buy these kits as well. These would be really gorgeous to display in your office, in your lobby, near the front desk. I can't imagine them, not selling really cute kits. And as I said, the mask is, really cute, branded with MDPen, very comfortable. For those of you that just want to go shopping that have watched this video, I do have a code you guys can use on our retail site. It is right there, spring19. And this code is good for 48 hours. So you can definitely use that on items that are not already discounted. I see a few more questions. The burning sensation and some red spots on the stomach after RF are normal. So yes, basically it should be normal unless, your pain level's getting on the higher end, and that's not normal. It should feel like a mild sunburn. If you see red spots, it depends what red spots you're talking about. Often with microneedling at those higher depths and with scars, you can get bleeding underneath the skin that can appear as red dots. This is not permanent, but that's what that is when you see that. So that's most likely what you're talking about. If you're talking about red marks like hives or urticaria or something, then no, that's not going to be normal. But yes, those little pinpoint bleeding under the skin when treating scars at higher depths can be normal. And those usually, fade within 3 to 5 days after the treatment. So definitely don't freak out if you do see those. Should I apply retinol or moisturizer for red, itchy stretch marks before microneedling? So as I said, you want to stop the retinol a week before your microneedling treatment. So no, I guess is the answer to that question. You can definitely use your moisturizer, up until the treatment, but retinol, you want to stop the week before and stop for 1 week after. So I think that's what you're asking. As long as you stop the week before, yes, absolutely. You can utilize your retinol, utilize your moisturizer. For those of you that don't know, retinol should be applied in the evening and can be worn overnight. You do not want to wear it in the sun. Any more questions, guys? Thank you so much. Hopefully you guys can, either buy the Mother's Day Sleeping Beauty kits, or if there's something else that you have in mind that you're really wanting, that code is up there, spring19. Again, thank you so much. All of our platforms are listed below. We would love if you would follow all of them. Please subscribe and like these videos if they are helpful. And I look forward to seeing you again soon. Bye.